Welcome everybody. Today I'm talking about testosterone replacement therapy. Now, TRT or testosterone replacement therapy has strikingly increased over the last decade for a number of reasons. One of the reasons I'll point to is actually highlighted quite actively in Drugs for Life by Joseph Dummett, that points out that rather than drug companies being driven by scientists these days, they're actually run by economists and marketeers who tend to make us think that we have more symptoms than we do, primarily by marketing. This is especially so in the States, where they tend to have more aggressive marketing, particularly when it comes to symptoms of low testosterone, which might be mood, libido, energy, weight gain. And we end up tending to go to the doctors fully armed and convincing the doctor that we have these issues. That may explain why, in a certain meta-analysis of testosterone replacement therapy, is that up to 30% of people hadn't actually had their testosterone levels assessed prior to being prescribed testosterone, which is quite scary. Testosterone is usually defined as being low when it's below 300 nanograms per deciliter. We usually have a primary or a secondary hypogonadic state, i.e. low sex hormone producing state. Now, if it's primary, it's usually there may be some issues or damage going on in the testicles. It could be secondary, which is our hypothalamus or pituitary, the areas in the brain that control the release of those hormones, most notably luteinizing hormone and follicle stimulating hormone, which affect the production of testosterone in the testicles themselves. So, an issue that we might have with this is there are other disease or suboptimal hormone states that might drive what is a low testosterone state. Let's take, for example, what the positive effects of testosterone are. Well, they're certainly associated with restoring blood sugar levels by increasing insulin sensitivity and making sure glucose levels are more optimal. It can help with building muscle tissue. We all know the anabolic or bodybuilding status of testosterone. And hence, when we have low levels of testosterone, we tend to see issues related to poor insulin sensitivity. We see the increasing of blood vessels, the tissue in the blood vessels increasing, which can increase the amount of blood pressure that we get because they remain less flexible. Now, problems that have been occurring or that are suggested within studies is, does taking testosterone replacement therapy increase the risk of cardiac events? And there are some studies that actually show, yes, short-term acute studies do actually increase risk within people who are perhaps older age, above 65 years of age. But perhaps in a younger cohort, it might actually be very, very productive. However, when they come to look at the studies where they've improved or added testosterone replacement into a specific population, one of the things or a couple of things that haven't resolved is, one is cholesterol levels when they're high, and also noticing things like inflammation is still being the same as well. And also the intimate thickness, which is the thickness of the arterial and blood vessel walls, tends to increasing that blood pressure. Now, what's well known is that if you're in a hypothyroid or low thyroid energy state, when you add thyroid hormone in, it's well known that not only does insulin sensitivity improve, not only does your testosterone levels improve, your thickness of your arteries tend to decrease, lowering blood pressure, and also cholesterol and inflammation also tends to lower as well. So there's going to be a specific population that do not need testosterone replacement therapy. What they need is adequate energy, adequate thyroid hormone, allow the pituitary and the hypothalamus to function effectively, and we should see testosterone levels increase. That's not to say that testosterone replacement for a number of people isn't going to be very, very beneficial. And certainly there can be areas where, restoring thyroid and restoring energetics isn't going to be the key impact or treatment that they need. But however, if we are going in and there are more physicians who are prescribing testosterone replacement therapy with not checking first of all if they have a testosterone level below 300 nanograms per deciliter, or they're just assuming that taking testosterone is going to be a big cure-all for these factors such as like low libido, mood state, muscle mass, increasing insulin sensitivity. But then, is it not just we're propping up and treating a bunch of symptoms rather than getting to the hierarchy? So my approach with a lot of people, first of all, is let's see what you're eating, let's see the stress levels, let's see how much exercise that you're doing before we think about looking at something as potentially problematic as increasing cardiac events, especially if you're in that older age group. So we need to make sure that your energy profile, your ability to produce energy, your ability to regenerate at night is the things that need addressing first of all before you even think about taking testosterone replacement therapy. Hope you found that useful. If you have any questions on specific testosterone replacement therapy or addressing energy and thyroid so that you can produce enough testosterone, then please feel free to get in touch. Hope that helps. Thank you very much.